3, 2, 1. I'm at Creekside Behavioral Health, a brand new facility opening up in Northeast Tennessee. And I have Jim with me here today, and he is actually the founder of Strategic Behavioral Health, who's the mastermind behind this organization. And I want to do an interview with you, particularly because the quality of your facilities, they're very innovative. And again, strategically, just to even come up here to the Northeast Tennessee to open it up. So would you like to tell everybody a little bit about why you chose Northeast Tennessee for your location of the hospital?
Sure. I think first and foremost, we identified the need in this given area. And I think that as a company, we have learned to build psychiatric hospitals around the country and have been able to have significant impact in those communities. And it's allowed us to identify communities, come and build a brand new facility, state-of-the-art facility, and really begin to be a true community resource. When we found this community, we recognized that there were a lot of patients going untreated for mental health and substance use disorders, and so we wanted to build a building that allowed us to take care of those patients.
What I really liked too that I heard a little while ago was the societal responsibility of the community here in the area.
Well, as care providers, we have a responsibility to answer to the community, quite frankly. And if we have knowledge of how to manage mental health and substance abuse disorders, how to influence, how to teach people how to intervene with folks that are struggling, then we have a responsibility to teach that in the community. What we do at Creekside here in Kingsport, Tennessee, is we provide 24 hours a day, 7 days a week, a free clinical assessment to figure out what's going on with a particular patient or family member. Most of the patients that go through that free assessment do not get admitted to the hospital. They need something, but we don't know exactly what it is until we sit down and do a free clinical assessment. Then our role in the community is to help them get to the right services at the right place and the right time. Our responsibility to the community is to be available 24 hours a day, 7 days a week for folks to be able to come and find out what kinds of services they need.
Because it doesn't matter what's going on, you always need that assessment first. And that's the first place everyone's going to tell you to go, is to get that assessment. It's just wonderful that you're offering that 24/7. So that's great.
We think it allows a community to feel the hospital as a true resource,
yes,
and a true benefit to the community.
Why don't you talk a little bit about the innovative side of this hospital?
Well, what you have to understand in America, we've spent years and years converting lots of different buildings into psychiatric hospitals. I mean, this has been a marginalized population. And so there haven't been brand new buildings built for this population. And so 12 years ago when I started the company, that was my goal, was to build brand new buildings that are specifically designed for this patient population. And so what we have done is we've taken years of having worked with this population and integrated it into a building that takes in patient safety, patient flow, staff safety, staff flow, and allows us to take better care of patients based on the design of the building. Now, I know that sounds a little odd, but when you can design a building that allows staff to take care of people better and easier, they get better care. And so we have some features around the building. We have 10-foot hallways, 10-foot ceilings, a carpet on the floor. That's all about making it feel less like an institution and more a homely environment for folks to feel like it's a therapeutic environment they can open up in. In addition, we have a geriatric specific unit that is designed specifically for geriatric patients. We built a walking track around the nurses station in the center, so geriatric patients like to wander, and so we let them wander unless it's time for group therapy or individual we let them wander, and they wander in eyesight of the direct care staff and of the nurses staff. And so we design our buildings thinking about this patient population and the kinds of things that they need to make it easier for us to take care of them. We're excited to be here. It took us about 5 years to get this project off the ground. But we're excited to be a real community resource. And we're most excited about partnering with providers in the community to work together when we're working with patients. Because success with patients is as much about what happens in this building as it is how we transition to the next level of care, to the next provider. So our goal is to integrate ourselves with all of those providers in the community so that we can do very warm, good handoffs for patients back and forth so that the patient doesn't suffer in that process.
That is so important, is to have that warm handoff, and like our logo here at Tennessee Advocacy Talk, to work together, to rise together. So I'm so glad that you are here, and congratulations on your new facility.
Thank you very much.
Thank you.
So really it's acute behavioral health, mental health, and then the substance use side, both on the detox but also on the treatment side.
Okay, so it's acute, and you guys do partial hospitalization as well, correct?
That's correct, yeah.
And what age ranges do you accept into your program?
So the facility is set up to actually do from pediatrics all the way to geriatric, so everything in between. What we're doing is starting out with 12, 12 to, basically plus.
Okay.
All the way to the gero side of it. And so really our focus is going to be looking at the adolescent, the adult mental health and substance use, and then gero unit, which is a dedicated unit for the geriatric population. And so we're going to start there, and then as we begin moving forward over the next year or so, we're going to be opening up our pediatrics, and then we're going to be expanding into our partial hospitalization and our intensive outpatient.
Okay.
And so that intensive outpatient over time, it'll start out with just MAT, just the medical,
MAT?
Yep, that's right, MAT. We'll probably look at that around January and see what the community needs are and what our referral needs are, and then begin expanding our partial hospitalization, ECT, and then also any of the other types of mental health outpatient. Okay,
and mental health outpatient is intensive outpatient therapy that you provide here, correct?
That's right, only intensive outpatient.
Okay,
yeah.
And what type of insurances do you accept?
Working on being paneled on all of the major, third-party payers, insurance companies, TennCare as well. It's basically anywhere from self-pay to TennCare all the way into all your major.
For the youth, are you taking custodial children as well, or is it just non-custodial?
Right now it's going to be a case-by-case situation.
How about transportation?
So what we have is we have some agreements with the Sullivan County EMS.
Okay.
And so then we're also going to have some limited transportation, intrinsic to our services for our patients. But I think in the end, transportation is always going to be a challenge. If that becomes an issue, we like to work with the patient directly and their family, but also the referring entity to see how we can work out some of those transportation challenges.
I know your bed count is 72, correct?
Yes, but what we'll begin doing is looking at what our referral need is and begin flexing and flowing some of our staff from a lower census unit to a higher census unit. But it's going to be 30 beds, and we'll kind of see how it goes. We're a community partner and really look forward to hearing from providers in the community. How can we do things well? How can we partner with you? How can we do things well? And if we do a misstep, or maybe that something happens along the process and you feel we could do something better, or you like what we have done and you want us to know about that, that would be great feedback for us. And one of the biggest things is we already have some folks that follow up on our referrals. Hey, you sent us somebody? Did we do a good job? And if we didn't, where can we improve on that? Because that's the key. If we're not caring for patients in a continuum of care, then we're not doing our jobs. And so part of that is making sure that we are taking care of that referral, communicating back, and improving our processes so that it is easy for providers to get a hold of us.
This is why we're doing this interview, because our mission here at TAD is to help increase the access and the quality of the care, and definitely strategic behavioral health has hit the nail right on the head.